Hello, everybody. Welcome. We will give you all a moment to log on and then we'll get started. All right, everyone. Hello and welcome to Keeping DSPs Fired Up but Not Burnt Out webinar. My name is Ina Collette and I'm the marketing specialist here at Intellectability. We're so excited to have you all here today. Before I turn this over to our presenters, I have just a few housekeeping notes. If you're having any audio difficulties, please check your speaker selection and volume. If that doesn't help, try leaving and rejoining the webinar or restarting your computer. This topic is likely to spark questions. Please feel free to use the questions feature in your control panel. Our presenters will make time to answer questions during the last 5 to 10 minutes of the webinar. This is being recorded, so about 1 hour after the webinar concludes, you will receive an attendance certificate and a link to the recording. We have a free resource sheet available to download in the handout section of your control panel. And then last but not least, I'll be dropping a link in our webinar for our webinar survey in the chat. We encourage and welcome your feedback. And if you could please take a few minutes to fill that out, we'd super appreciate it. That wraps up everything up. And I will now pass it over to our lovely presenters.
Muted. There we go. And welcome to everyone. And it's so great that I forgot to unmute myself. So it's perfect. All right. Welcome everybody to the IDD Perspectives webinar series, Keeping DSPs Fired Up but Not Burnt Out. Our guest today is John Raffaele, and we're going to have a lot of fun. So I'm going to first start by telling you a little bit about who I am. Most of you probably know I'm Craig Escudé. I'm a family physician and president of Intellectability. I've worked in this field for 30 plus years, 20 of it clinically. Didn't know a lot about how to provide good health care for people with IDD early on in my career and learned a lot over the years. And now I'm very thankful that I get to share information that can help everyone out there, support people with intellectual and developmental disabilities in as good a way as possible, and help them recognize health risks that are so often missed that result in lower qualities of life and increased hospitalizations and prolonged suffering from treatable conditions. I'm the president of Intellectability. I'm the author of the Clinical Pearls in IDD Healthcare, the Curriculum in IDD Healthcare, which is an e-learning course to train clinicians, and also the host of the IDD Health Matters podcast. John, I'm going to turn it over to you to introduce yourself.
Hey, Craig, thank you so much for having me, and I'm so excited. We are going to have fun. We're going to have fun. My background, oh gosh, I look at that first thing, over 35 years experience, and actually it can go up to probably almost 40 years I've been doing this stuff. And this stuff meaning and being ultimately working in the world of direct support back in the mid 80s, when I was a 20-year-old college student in and out of college. I got a job by accident as a direct support professional, and really I haven't left. But in those years being a direct support professional, I saw early on the incredible value and power of the work and how I fell in love with the work. But I also saw, and we'll talk about this later, that it's still a profession that's kind of ill-defined and not respected the way it needs to be respected. So I became a social worker. And when I became a social worker, I did not leave direct support. My social work is all about the development of direct support professionals. I'm a community organizer. I'm a group worker, really. That's the kind of social work I do. I'm not really a clinical social worker. I've worked in provider organizations. I've worked in the context uh, of individual consulting practices for organizations that work with direct support professionals. But basically, for the last decade, I've been at a full-time capacity with something called the National Alliance for Direct Support Professionals, and we'll talk about that also in a little bit. But ultimately, I'm an old direct support professional. I'm also just an old guy, but I'm an old direct support professional that hopefully after today's conversation with Craig, you'll see that what I'm talking about, I think you're going to all identify with, because the world of direct support is something we need to know a lot about, but also direct support professionals are often, they can get very burnt out very easily. And we're going to talk about that. How do we prevent that? Among other things, which who knows the roads we're going to go down in terms of
Who knows? That's exactly right. And the hard part is going to be to keep this to the 45 minutes that we have
yes.
between you and I talking, and how much we always enjoy talking with each other. You know, we're going to talk about burnout, but let's start off by talking about what motivates a direct support professional? How do we help them stay motivated in the very important and very valuable that they work that they do in this field?
I think first and foremost, Craig, the number one thing that any direct support professional will tell you, what keeps them coming back, what keeps them doing this work, whether it's for they're new at it or whether they've been doing it 30 years, always this: it's the people. It's the people they support. Always. That's the number one answer. And it's, which is really quite amazing, right? You know, because you think they get paid pretty poorly as a profession. Sometimes working conditions are challenging, long hours, just challenging stuff you got to deal with every day. So first and foremost, I think that's what keeps people motivated. But that's not enough, right?
No.
That's not enough. So when you look at the things that are kind of listed on the screen there, if you can see the screen, one thing I know also that direct support professionals will tell me and tell us at the National Alliance for Direct Support Professionals, they rely on good supervisors. They rely on supervisors that are more than just managers. Um, they, 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 they love the supervisors that they have who take the role of mentorship and are mentors, who are teachers, who are coaches. And there's some supervisors out there that are just fantastic. Um, the other thing is that most direct support professionals that work in perhaps residential such situations, if you will, whether it's a group home or a day program or whatever it might be, when they're working with other direct support professionals, most DSPs work in the context of a team. And
Mhm.
that's also another element of what keeps DSPs motivated. If they're working in a team where it's toxic, if where there's, you know, low morale or whatever, and that seems obvious, but that can drive direct support professionals not only to burnout, but it can drive them to leave,
Sure.
despite the passion they have for the people they support, right? But the other things that are listed on that slide, I think that's why we kind of came up with some of these things to guide our conversation.
Right.
When you think about bringing your best self to work, Craig, um, I think we might take that for granted. I think bringing your best self to work is easier said than done. Even when we're excited about what we do for our job or our occupation or our profession, because we also have personal lives. You know, we have sometimes complicated personal lives.
Right.
Maybe we're dealing with illness, we're dealing with maybe some kind of domestic struggles in our relationship. When you look at direct support professionals, many direct support professionals are single mothers. They're the head of the household, so you know, bringing your best self, which is motivating, sometimes that can be difficult. And you have to rely on good supervisors, good team members, and ultimately understanding what drives you so that you can remain motivated and remain fired up and not burnt out, you know.
You know, John, I've seen or heard this from some organizations more and more over the recent years, where the organization leadership is taking a real interest in supporting the direct support professionals themselves, and looking at their own lives and how can they support them even outside of work. How can they make it easier for a direct support professional to come to work in a good mindset, or to, can they assist with some of their own needs? Can they assist with childcare if that's a reason why a person can't come in? And I love seeing that from these organizations, that they're really not only supporting people with IDD, but they're supporting the people that they're wanting to help better support people with IDD, including the DSPs. Have you seen some of those things happening?
Oh goodness, yes, and it's glorious to see that. In my opinion, when an employer, provider, organization, whatever you want to uh, call it, when they do things that are obviously, most organizations, they have great missions. We're a mission driven
Field, yeah.
field, right? And so organizations have usually these fantastic mission statements, and they do wonderful things for people with intellectual developmental disabilities, and the progressive things that they do, and the wonderful adaptive equipment that they're getting, and et cetera. And that's great. We want that to continue. But for those organizations, like you said, Craig, that are doing for the workforce the same robust level of support, that's so critical. In fact, the National Alliance for Direct Support Professionals, in tandem with ANCOR, the American Network of Community Options and Resources, and the Institute for Community Integration at the University of Minnesota, we offer an award every year. It's called the Moving Mountains Award, and it's exactly given to organizations. Not given, they earn it. They earn this award because they're doing exactly what you're saying. They're doing something for the workforce that's progressive, that meets their needs as a workforce, not just with training and development and all that good stuff. They're doing things that are like here's an example. Like, there's one organization I remember. They had, bigger organizations have fleets of vehicles, and they might have 80, 90 vehicles that, instead of turning them in, they take a portion of those vehicles and they kind of offer them at a reduced rate for the direct support professionals.
Nice.
Things like that. So important.
Yeah.
It's a great message for an employer towards the direct support professional workforce, but it's also just it's the right thing to do for this particular workforce that is underpaid and undervalued. So, I can talk all day about that.
Yeah, well, I want to expand a little bit on that last one here, because I think this is so important to regularly reflect on the difference that you make in other people's lives. And it's easy to get caught up in, oh, I've got to document this. I've got all this paperwork. I've got all these things I've got to do. I've got all these things I'm responsible for. And those are challenging. It's challenging in any field. It's challenging for a physician to have to document all of the things. Why can't I just treat the patient and do what's right, do what I need to do? But when you recognize as a direct support professional how much of an impact you have on the lives of the people that you're supporting, you should be proud of that. It is something to revere. You may help prevent a person from getting sick, or from dying from something, or from suffering from some condition, because you recognize that this person is holding his mouth funny. I wonder if there's a dental problem, or this person has not been eating very well. That we see constipation a lot in this field. Could that be what's going on? And the work that you do actually can save lives. I will go that far to say that, not just support people to live a life that they enjoy and help guide them through life, but you can actually save their lives in the work that you do every day, and that's something to be very, very proud of.
100%. And I can't tell you the number of stories where literally like you said, direct support professionals, because they knew the bowel habits of somebody, and those bowel habits were off. The person seemed off, and one thing led to another. They called a nurse in. Nurse did their evaluation. That person in an hour was in the emergency room, and within 3 hours was in the operating room dealing with that blockage of the
Yep.
intestines.
Yep.
And it's because of that assessment skill, that unbelievable nuanced relationship that a direct support professional has with the people they support. If they're a good direct support professional, they're going to know that person so well, and they're going to know if somebody's off. And that might not be a technical term as a physician, but they know it. And damn it, you're right.
The number one reason I was asked to see people with disabilities by the direct support professional was, hey doc, can you take a look at him? He's just not acting right. And sometimes that's all you get. But what you learn is you learn to listen as a clinician, because if the DSP who knows that person says they're not acting right, there is something going on.
And let me just publicly thank you. I'm going to publicly thank you, Craig. That you don't get all embarrassed. All right, just stop. But don't. You know what? I've seen too many times, and you know this. I'm not speaking to somebody that doesn't know this. There's physicians out there that don't listen.
Yes.
And shame on them. And if anything, you have given, I think, a reason for physicians to listen, not only people with disabilities, but my gosh, listen to those people that are working with them, because they truly, truly know them better than, probably in some ways better than anybody. And darn it, that regularly reflect on the difference you make in people's lives, not only just the medical things, I think mental, emotional aspects of working with people with disabilities. Think about we had that thing a couple years ago. What was it? Oh, the pandemic. Remember that?
That little old thing.
The little old pesky pandemic we had. My goodness, Greg. It came brilliantly clear that, my gosh, if not for direct support professionals, not only would people have probably perished, because COVID really hit people with disabilities much harder in terms of mortality, but what direct support professionals did to help people with the isolation, people that are isolated already based on the nature of having an intellectual disability. Direct support professionals would quarantine with people. They would literally, they would get sick and then wind up locked down with people.
Yep.
Reflect on that. I think that's the negative stuff, but the impact that DSPs have, it can't be understated. We have to make it clear.
So with all of the responsibilities that direct support professionals have, it can be very overwhelming, very, very taxing on the person.
Sure.
What can DSPs do themselves that can help prevent burnout?
We could have the whole discussion on this, right? To narrow it down, though. So it's interesting, Craig. The National Alliance for Direct Support Professionals has a national certification program. It's called the eBadge Academy, and it's really the only national certification program for direct support professionals to get a credential, right? And one of the ways in which you get this credential is you have to submit testimonials. They're electronic badges. I'm not going to get into that, but one of the badges, you can get a badge just explaining what you've done to care for yourself. It's called a self-care badge. It's one of the most underutilized of all the badges, because DSPs are very selfless people generally. And darn it, I got to say, it's one of the reasons we've exploited this workforce as a system, not you and I, but the system has exploited this workforce because of their selflessness. But that said, that doesn't give an excuse for, burning the heck out of these DSPs. So what we can do, whether it's this webinar and people listening in, and hey, listen up, folks, but provider organizations, employers, family members, parents that have DSPs, employed, encourage those direct support professionals to take care of themselves. What does that mean? That's a big, tall order. What does that mean? Well, it could be as simple as, taking that paid time off and not working, doing, and that's hard. That's hard because a lot
actually taking time off.
Actually taking time off. I mean, you and I are probably the last people to, do as I say, not as I do, because I don't take any time off. I love my work. You love your work. DSPs love their work, but the reality is people have to take time off for self-care,
Yep.
whatever that looks like. Just taking an afternoon and going to a movie. That's hard for direct support professionals because a lot of them they're working literally be below the living wage. So they have 2 jobs or 3 jobs. So to take a day off, that's easier said than done, right? So, but take a day off, do something fun, go do whatever it is that you like to do. But here you go. The other things that I think are more in line with what you can do on an ongoing basis, a lot of direct support professionals are spiritual people. They're religious folks. And that's wonderful. That can be a huge source
Yes.
of sustenance, of renewal. Whatever that religion is, whatever that spiritual practice is, so be it. Um, and that I know I love when I'm at a in some kind of position where I can, I go to a lot of organizations and, I'll talk to direct support professionals, and a lot of DSPs, they talk about their church experience or their mosque experience, um, and they'll relate what they do to what drives them in terms of their religion that nourishes them. So be it, whatever that is. That's great. Um, Good old exercise, Greg. Good
Yep.
old exercise. Um, you're a physician. You know better than anybody. My gosh, when you exercise, it absolutely releases endorphins, and it does things with your bloodstream and your blood flow. It mentally, physically, you feel better. Um,
Absolutely.
and once again, we're not saying go become triathletes or run marathons. You don't have to do it. Go for get a walk routine happening. If you have a dog and you're a direct support, hey, exercise with the people you support.
Yep.
That's a huge thing because oftentimes the folks we support could use some
Yeah.
exercise.
And if there's an opportunity at work and you have a break, you've got a 15-minute break, go for a walk, do some squats and push-ups and sit-ups. And those things can and have been shown to elevate your mood.
Without a doubt.
Yeah.
Without a doubt. And here's the thing too, real quickly. I think a lot of direct support professionals, what they'll do in their personal time, a lot of DSPs do volunteer stuff. It just once again, it's in the
In their
nature.
nature. Yeah.
It's in their nature. So they'll be volunteering at their local community center or their local church or food bank or whatever it is. And it's very noble. It's wonderful. And if that fills your bucket, that's great. Do that, please. But once again, leaving work at work, right?
That's not easy all the
Hard.
time, especially in a field like this where maybe somebody you've been supporting is dealing with some big challenge. How do you just walk out at 3 p.m. at the end of your shift and turn that off? This is tough.
And it goes back to Craig. It goes back to one of the first things we talked about, that supervisory support, that team support. You have to be able to separate sometimes. It's almost impossible in the human services. I'm sure it's almost impossible as a physician. I'm sure you're probably trained how to separate yourself sometimes. I mean, you're involved in life and death with people, literally. And I mean, direct support professionals, maybe not life and death every day, but my goodness gracious, major, like if you're supporting somebody with some psychiatric disabilities, when somebody's having a decompensation and they're having a real rough time and maybe they have to go into some kind of inpatient treatment, you don't just forget about that person. A lot of DSPs they'll go and visit on their off time. Again, that's fine. No harm, no foul there, but you got to be able to and work with your supervisors, work with your teammates. How do I gotta take a break? How can you help me leave
Yep.
work? So that's critical.
Yes, absolutely. So you mentioned the NADSP, the National Alliance for Direct Support Professionals,
Yeah,
and there are some practices and a code of ethics. So let's talk about that a little bit.
sure thing, sure thing. So a code of any profession, but so Dr. Escudé, MD, did you have to attest to that thing called the Hippocratic Oath when you
I, sh-
became a physician?
I sure did. We actually said it out loud on medical school graduation.
There you go. That's one of the most ancient of codes of ethics. in all the professions ever, right? So what that does for physicians is it's similar to what the code of ethics does for direct support professionals. It acts as a compass, right? And so what that means for direct support professionals, oftentimes, you're trained to do all kinds of things. You're trained to do hundreds, thousands of different things you're trained to do. But here's the thing, many times something happens in your daily work as a direct support professional you weren't trained to do. Like, what do I do now? We call
Yep.
there's a technical term. It's called the "oh no" moments. Oh no. So what do I do now? Somebody is doing something that I was not trained. So let me give you an example, right? So you're in you're in a public setting, and the person you support suddenly starts to have a difficult time, and they start to cuss and swear a little bit, and they start to get a little agitated. And yeah, maybe you've been taught some crisis intervention techniques, but it's still in that moment. Oh my goodness gracious, you're uncomfortable. They're uncomfortable. People in the store are wondering what to do. Maybe a security guard is like kind of coming close to the situation. What do I do ethically in this situation? Am I going to shut this person? Hey, you be quiet. You be quiet over there. Hey, knock it off. You're not going to do that. What do you do? So ethically, you have a responsibility as a paid direct support professional to intervene in that situation. So what is the ethical thing to do? So the ethical thing is to diffuse things, promote that person's emotional well-being, make sure that respect is as much as it can be happening in that situation, making sure that the dignity of that person is kept as best it can be. Confidentiality. I mean, you're not going to yell at, well, that person has a psychiatric disability and that's why they're screaming. You're not going to say that.
Right.
So you might want to say that because of what they're demonstrating. You don't know what else to say, but you wouldn't say that. See where I'm going with this? So I think ethics, the NADSP, we've had a code of ethics for the last 26, 27 years, created by direct support professionals, people with disabilities, family members, a whole cross section of people are the people responsible for creating this code of ethics. And what this code of ethics, we recently revised it, and it's been validated, and it's really good. I recommend anybody, you can go on our website and it's free, you go grab it. But what it is, it's kind of the guidelines of what the values you need to have to do this work. Not your values, but the values of our profession. Just like the Hippocratic Oath are the values of medicine and what your obligation is as a physician, beyond what your skills are, what you need to bring to your work in this profession. And it's easier said than done, man. And I think that transforming daily practice, right? That's what all professionals do. Every day they practice, right? And one thing that we practice is how do we raise our ethical standards? So that's what the code of ethics is about.
So is the code of ethics something for DSPs specifically, or is it something that you think employers of DSPs could benefit from utilizing and understanding as well?
Great question. You gave me a softball there. Initially, the first code of ethics that we had back, and it was back in 2001, it was published and created. It was written for the employers, essentially. It was written for the field. That this is what direct support professionals should be doing. This is their obligation in terms of their values and what they need to believe and what they need to do. When we looked at it over the 25 years of its evolution, the new code of ethics, the 2026 code of ethics, is in fact, Craig, it's written almost directly to direct support professionals. It's the way in which, again, we're not going to get into the specifics of it, but when you read it, you'll see that I will, as a direct support professional, XYZ, I will. And one of the tenets of the code is professionalism, accountability, and growth. And that particular tenet of this code of ethics, this new code of ethics, it's spot on. This is what you need to do. All right, this is what you need to do. So it's very much authored to and for direct support professionals.
Very good.
But that said, Craig, it's applicable to anybody that's going to engage with somebody with a disability, but it's geared towards DSPs. So
to anybody. So this would be good for everybody to look at.
Yeah. I would hope a lot of physicians would take a look at it. When they are in that place, when they're in a clinical setting with somebody with an intellectual developmental disability, this would absolutely help them with
It
their.
would. That
Yeah,
makes sense.
yeah, yeah.
Okay, John, AI is the thing. Or at least the thing everybody's talking about, and we all have various experiences and opinions. What's going to happen with AI and the advances in technology? Are they going to replace direct support professionals? Are they going to enhance things? Are they going to cause more challenges? What are you thinking?
Oh man, you know, I'm old enough. There was this cartoon back in the '70s, and it was called the Jetsons. The
Mm-hmm.
If you remember the Jetsons, Craig, so you're
Oh, very much so. No, 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 that's way before my time.
good. For those of you that know the Jetsons, meet George Jetson,
Yeah.
his boy. All right. It was it was very futuristic, other than the cars, which were flying vehicles. Right? That's come true. Everything in the Jetsons kind of has come true in a lot of ways. Like these things that we have here. Is it
Yeah.
is it a phone? Is it a phone, Craig? Is it a camera?
It's
Is
an accessory brain for
it
me.
TV? So here you go. Uh, to answer your question, no, direct support professionals will never ever be replaced. You can't do that. You can't.
AI cannot hold someone's hand.
Nope, nope. It can't hug them when they're in a crisis and they need a hug. It can't talk to them and necessarily joke about the things that you can joke about with somebody to help them de-escalate. It can't, it can't say good morning in a way that's sincere. They
Yeah.
can try. They can try all they want. I don't care if it's Claude, if it's Copilot, if it's Chat GPT, if it's Elliot, if it's Jim, if whatever the heck it is, right? Yeah,
Right.
and I love they're trying to. It's here you go, Craig. I'm gonna do a 50-cent word. AI tries to anthropomorphize.
Ooh.
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 Those of you that don't know what that is, Google it and tell me later. When you can't substitute human connection. You just can't, Craig. You can't.
No, you can't.
And but that said, so the other side of it, and I think this is a very, very important. If anything, artificial intelligence can embellish, can I think enhance direct support professionals' functions. And I think one way is documentation. You
Yeah.
spoke to it before.
Yes, that one in particular.
It's a bear. Documentation is very difficult for everybody. I don't care if you're a physician, if you're a nurse, a direct support professional. Documentation is critical. It needs to be done properly. It needs to be done ethically. It needs to be done correctly. But here you go. Think of the demographics for direct support professionals. There's a lot of DSPs that English is their second or maybe their third language. So most of the documentation, at least here in the United States, it's in English, right? Medication administration documentation has to be in English. That's hard. That's hard for people that know English, let alone if it's a second language. So that said, something like AI as a supplement to a documentation. And I know there's plenty of companies out there that are meeting that need and addressing it in a really positive way. And it's great. But here's the other thing, like smart homes, right? Smart homes. You've heard of smart homes, I would
Yep.
assume, Greg. I wish I had a smart home. Smart. I mean, a smart refrigerator. Ever see smart refrigerators? I love the smart refrigerators, which
Look inside your fridge and tell you what you need to order more of.
all of that, and medication administration, all the ways in which dispensers for it's happening in hospitals, right? I mean, in hospitals, there's all these unbelievably automated, whether it's AI or just automation, that limit and help prevent our medication
Errors,
errors,
reducing. Yep.
which can happen a lot. But just medication alone, think about that. How a direct support professional could benefit from some kind of technology that's going to help them better administer medication and more accurately document that. So, but still, at the end of any day, It's the relationship that the human being has with another human being that's going to matter.
Absolutely.
You know,
I'm gonna give one word of caution in AI use as we're seeing it everywhere.
yeah,
Um, Whatever technology you might use, especially if you're going to be utilizing something to document your notes for you and all of that, I'm going to just say this. This is blanketly across the whole field. AI doesn't always get things just right.
yeah,
Even if you're speaking into it and it's going to then compile a note for you
yeah,
down the road, the responsibility is on the human being to read that and make sure it's 100% accurate, because you are still responsible for what AI is writing. So that's
yeah.
just a word of caution I have to say
Good for you. Yeah.
about AI. But there are certainly a lot of benefits and values. But like anything, if we become too heavily reliant on something like this, we can walk ourselves into trouble.
Oh,
So
well, you sure
gotta
can.
gotta keep that in mind.
Absolutely. Thank you for mentioning that. And like one other thing, when this is a webinar about a conversation about burnout
Mhm.
and about the stresses of the direct support role, and looking at AI and technology in the positive light to reduce, to mitigate things like the documentation tasks and the medication administration tasks. That's what we're talking about. That's what we
Yeah.
want to see. Again, using it carefully, like you just indicated, um, but let's leverage it so
Yes.
that it can. We'll have more time in the human connection when the documentation piece is.
That's exactly where it should be. You can spend less time documenting and more time with the person that you're actually supporting, providing that direct support rather than writing notes.
Mhm. There it
Yeah,
is.
that's definitely. But when you sign it, you're signing it. So just remember that. Make sure it has transcribed what you want it to
It,
transcribe.
real quickly. I know we don't.
Yeah.
We're good. This is because this is funny. It's a funny story about me being this old guy that So I hear this advertisement on radio. I heard it for like a couple months, and it was about this AI company. It was on public radio, and they were talking about what it does, and it doesn't hallucinate. And I didn't know what the heck that meant. What are they talking about? I mean, because I'm from the 70s and 60s and 70s. I mean, hallucinate. That means you take hallucinogenic drugs. I mean, the AI is taking LSD. What's going on? And now I realize what hallucination is, and it's what you just talked about. It's like the AI comes up with things that you got to check.
Yeah.
So
It'll fill in a blank here or there.
don't let it hallucinate.
That may not be real. You mentioned the pandemic earlier, and we all have learned lots of lessons as a society from the pandemic. And I've learned some related to this field specifically from the pandemic. What have DSPs, or what have you learned about DSPs from the pandemic?
It's simple, Craig. It does. I don't have to talk a lot about this. It validated their value. One of the things that happened in the pandemic, and this happened a lot, like there was this who's an essential worker? Who's an essential
Yeah.
worker? That was the big thing, remember? And literally people were were stopped by the authorities if they were on the streets, and you shouldn't be out and about, et cetera, et cetera. Um, and that happened with direct support professionals. And we had to go to bat for in certain states around the country as the National Alliance for Direct Support Professionals, defining, what DSPs do is indeed essential. Without the DSPs' involvement, in their doing their employment, going to work during the pandemic, uh, people are going to get in bed. People could die. So I think that's one thing that we saw, and was just we always knew. I think you, me, we always knew, but I think the society, even parts of our system. So wow, these direct support professionals are really important, aren't they? And I think that came out. The other thing is, I think, the clarification of their role.
Yes.
So, DSPs aren't just medical professionals, right? They were part and parcel helping people who were isolated. I spoke about this before. They were people with intellectual developmental disabilities can be isolated to begin with. for various reasons. We know that. Not a lot of friends necessarily, not a lot of, other than paid friends sometimes, and sadly.
Hmm.
But what we saw was direct support professionals created situations where people were not isolated on top of being isolated in a pandemic.
Yep.
That was, I mean, you're watching, TV shows now that are kind of almost looking back at the pandemic. I just was watching, I forget what it was, but it was, oh, it was called it was the Four Seasons. It's a new thing on
Hmm.
Netflix. It's a series, and it was this one segment about how it was isolating back in the, back during the pandemic, which was only 4 years ago, right? DSPs, direct support professionals, they were absolutely emotionally, they were emotional uh, uh, supports beyond what you could imagine for people with disabilities.
Yep.
They were psychologists. They were counselors, and you know what? Their role is all encompassing, and that was made clear during the pandemic. Absolutely.
Absolutely. And we saw the push. One of the things we saw is that you couldn't accompany anyone into a hospital, anybody who went into the hospital.
Right.
But direct support professionals are invaluable to people with intellectual disabilities, and they can assist with communication with the healthcare staff and help. There's so many things that they can do. But that was another thing that we saw, is that no one was being allowed to be in the hospital, which caused some big problems, and there was a movement to allow that to happen, because direct support professionals were essential to that person
Yep.
in their lives.
Yep. Yep. And anecdotally, a quick, tiny little story here. Um, we interviewed, oh my God, we interviewed hundreds of direct support professionals through the pandemic. We did some research. We took advantage of this horrible crisis to get
Sure.
some data, right? And so I interviewed, I don't even know how many direct support professionals over Zoom. One of the stories I got was really profound, was about masks, right? So
Mm.
people wear masks, and when you wear a mask, it's it was off-putting for all of us.
Sure.
For a person with a disability, um, communication is critical sometimes, full face communication. But I remember this one story. The direct support professional had such a relationship with the person they supported. The eye contact alone, they were able to do eye contact that was able to supplement also what was being verbally spoken through the mask. And I just remember that the story was about, the person seemed to uh, not not get as fearful and not be so freaked out, because they were able to communicate just eye contact alone. And I bet that happened with a lot of direct support professionals, because once again, direct support professionals, a lot of people with intellectual disabilities, they don't use this language, this
Right.
highfalutin language to communicate. They often communicate with eye contact. DSPs are experts at that. Experts at that.
Absolutely.
So, oh, I got a million stories. Anyway, shut me up.
Yeah. So as we come to a close, I think, first, DSPs out there, you are appreciated by many, 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 many people. I know it's a tough job. I know it's hard. I know it's challenging, but you make a real difference in people's lives. So know that, and know that there are organizations like the NADSP out there that are all on your, they're there for you. So if you're not familiar with NADSP, get on their website, learn about the organization and how you can be a part of that and take part in some of the great things that the organization offers. And keep on doing the incredible work that you're doing. I want to let you know, as we come to a close here, about a couple of handouts that are there. We put this one out for you to download in the handouts section. And it's one of the basic things that I think anyone who works with people with IDD should understand. And it's something that we call the Fatal Five. They're the top preventable causes of illness and death in people with IDD. And so this is kind of an introduction to those. If you're not familiar with that term, this is a really easy way to learn about it. If you are working at an organization and you want to train supporters who work there, there are easy ways to do that for health-related issues, including on the Fatal Five. We have an e-learn course that's geared specifically to direct support professionals to teach them about these top causes of preventable illness and death. People can take it on their own, but what we would rather do is have the supporters, the organizations, license it and make it available to all of their staff, and it can be used very easily to have ongoing training in the Fatal Five. And we also need to make sure that we support people in ways that encourage them to do things and enjoy their own lives. So when we learn how to support people in person-centered ways, we can balance keeping someone healthy and safe with also letting that person have some positive control in their life to shape their life, to do the things that they want to do and live a life that they love. And we can provide training for those in that way as well, in a lot of different ways. And there's a class that still has some seating available in September to do that. We take these webinars very seriously. We take your feedback very seriously. We always want to provide information that's valuable to you. This webinar resulted from earlier recommendations from feedback that we had, where people wanted to learn more about how to prevent burnout and how to keep the direct support professionals motivated to do their job. So we very much appreciate your feedback on the surveys. You can there should be a link, I think, in the chat, and you will receive an email that should have a survey link after this webinar is over. I do want to point you to the IDD Health Matters podcast if you want to hear more information like this from people in the field, from direct support professionals, from nurses, from doctors, from provider organizations, and even John. John's been a guest on the IDD Health Matters podcast as well. So lots of ways to connect with us. We really appreciate you joining this webinar. John, I can't thank you for sharing your insights. They're extremely valuable, and we look forward to seeing you on the next IDD Health Matters, not podcast, but the IDD Perspectives webinar that we host, I think, in a couple of months. So we hope to see you soon. Thank you all for joining us today.
Everybody, thanks, Craig.